So I think that changing the tax code, and finally, Mitch McConnell started talking on the talk shows a couple of Sundays ago saying, we need to change the tax code. And there are a lot of Democrats that believe that that's a good idea, but if we could open up the market, we will lead to a more competitive insurance industry and new entrants into the insurance market. I think if the feds want to do one thing, one of the things they could do is increase their funding to the state-run high-risk pools. 35 states today have high-risk pools, but a lot of them have waiting lists because they don't have the funding. So if the feds want to do something, provide funding to the states for beefing up their high-risk pools to reduce the waiting list. And then when we get a competitive market going in healthcare, the state-run high-risk pools can disappear, and we will have an active insurance market like we do in car insurance or long-term care or life insurance. We also need medical malpractice reform. You know, if you listen to the president's speech, the one in August, where he said, well, you know, our costs are too high. You know, doctors are trying to make too much money. You know, there's the red pill, the blue pill, it doesn't matter. So-and-so's having a tonsillectomy. Doctors are doing this to line their own pockets. Well, you know, that just isn't the case. Doctors do a lot of tests and they provide a lot of pills and things because they are afraid of being sued. The cost, according to PricewaterhouseCoopers, of medical malpractice in this country for doctors to practice defensive medicine is $210 billion a year. Texas did med-mal reform back in 2003. 16,000 new doctors have gone back into the state of Texas. Doctors' premiums have gone down, and premium insurance rates for individuals have also gone down. They capped non-economic damages at $250,000, and they capped punitive damages at $500,000. California's had the micro law for years, and so it's worked very well. You know, I don't think medical malpractice reform is a federal issue, but I think if the administration and key people can talk about it and get states to enact medical malpractice reform, a lot of docs have got out of the practice of medicine, particularly OBGYNs and neurosurgeons, because they're paying upwards of $150,000 a year for their med-mal insurance, and it's not worth it to them. So we want to encourage people, doctors, to practice medicine, but not do a lot of extra testing, which adds to costs, because they are afraid of being sued. As I mentioned, insurance should be portable, and I think that is a very important part, because people are afraid to quit their job if they get their insurance through their job, because they might not be able to get insurance. I also believe we should allow people to buy insurance across state lines. People can buy their car insurance across state lines, but right now you can't buy your health insurance. So if you're one of those young men I was talking about in New York who would have to pay $9,000 or $10,000 a year for health insurance, and you're healthy, you know, why can't you go to Arizona or Idaho or Nevada, whatever state offers the kind of insurance that would suit your particular needs? It's a very straightforward argument, and I think it should be done. States should reduce mandates. As I said, we have over 2,000 mandates on insurance companies in this country. California has 46. They range in this country. Massachusetts has about 46. They include in vitro fertilization. Now, you know, if I want an insurance plan that covers in vitro fertilization, it is one of the most expensive mandates out there. But if I want that, I should be able to buy an insurance plan, you know, with it. But why should Jeff have to buy an insurance plan that covers in vitro fertilization and subsidize me unless he's thinking about becoming pregnant? I mean, I just think that, you know, these mandates now, there's an autism spectrum, there's hair prostheses, all of these things add 20 to 50% to the cost of an insurance plan. People, they should be there, you can buy them, but you shouldn't be mandated that you have to buy a plan that has them. I also believe that health savings accounts, which were part of George Bush's Medicare Modernization Act in December '03, health savings accounts passed. That's you set up a deposit account. You put money, or your employer puts money every month into your HSA. You can carry it forward, interest-free for years, and you use it when you need it. And it's combined with a high deductible insurance plan. Insurance should be there to cover catastrophes, not to cover a visit to the doctor for a sore throat or some of these things. But that's what happens when you have what I call, as I mentioned earlier, first dollar coverage. The question I ask you is, who do you want to control your health care and make your decisions? An HMO bureaucrat, a government bureaucrat, or do you yourself want to be in charge of your health care? As Newfoundland Premier Danny Williams told the Canadian media in his press conference and the American media when he went to Florida for his heart valve surgery, it's my health and it's my choice. I think that we want to keep telling people that healthcare is yours and it shouldn't be the responsibility of government to make decisions about what kind of healthcare you can have. Universal choice is the key to universal coverage in this country. Moving to patient-centered solutions will ensure affordable, accessible, quality health care. The excitement over government-mandated universal coverage as a solution to our problems is going to take us down that path to a Canadian-style single-payer system. Our taxes will go up, the quality of our health care will go down. Canadians come to the United States, 41,000 every year, to pay out of pocket for procedures. Where will the best docs in America go? Where will we as patients go if we want to get away from ration care? As my friend PJ O'Rourke says, if you think healthcare is expensive now, just wait until it's free. Thank you. Questions? Yes.
The little question, at the beginning you talked about the Secretary of HHS actually intercepting price increases by insurance companies at the state level. I don't know if anybody's read the U.S. Constitution. I think that's slightly
unconstitutional. Yes, and I said, I did a blog post for National Journal the other day, and I said, is this constitutional? Because I don't even believe that having an individual mandate that people buy insurance would stand up to constitutional scrutiny. The one thing I worry about is if Obama gets the plan and there is a challenge on the Constitution, it goes to the Supreme Court. One can't always rely on how the court votes today, and so if they voted that it was constitutional, if the Republicans take control of in 2012 the White House, the Senate, and Congress, which looks like it could happen if the Republicans have a great candidate, a great leader, you know, if the court has made that decision, it might be more difficult to repeal the health care bill. But what we do know is, remember Dan Rostenkowski, he was run out of town for Medicare catastrophic, and it was reversed. So I think, you know, if the Republicans can, you know, do well and get control, if we do have this bill, because as I said, most of the taxes come into effect immediately, but the benefits for the American people are not going to kick in. Originally, the Senate bill was 2014, the House 2013. Now it's up to 2016. So there's a lot of time that the American people will be fired up. We're paying all these taxes, and where are my benefits? So it would be a good opportunity for having it repealed. Yes?
I'd like to ask a question, but before I do, I'd like to give some information to anybody who has a pencil and a piece of paper and who would like to call Dina Titus about the health care bill. Dina's telephone number is 387-4941. She's waiting for your call today. Could you, just a rough percentage, could you give us a sense of the combined percentage of the total health care bill that's attributable to medical malpractice lawsuits and defensive medicine?